brain is composed of gray and white matter that contains millions of nerve cells. These nerve cells communicate through the release of neurotransmitters. Once a nerve is stimulated, it releases a neurotransmitter which binds to another receiving nerve cell surface, causing the electrical impulse to now travel through that cell and onto the next cell. Parkinson's disease is a degeneration of the area of the brain responsible for muscle movements, specifically the pigmented neurons in the substantia nigra in the midbrain. The destruction of these neurons results in a decreased availability of dopamine, which is a type of neurotransmitter. As a result, nerves can't send their signal to other nerves dictating specific body movements. The result is body tremors, slowness of movement, rigidity, and balance problems. The central nervous system includes nerves in the brain and spinal cord. A fatty product called myelin surrounds most nerves in our body. Myelin allows our nerves to send clear electrical impulses faster and more efficiently from the nerve cells or neurons. Multiple sclerosis is called an autoimmune disease, meaning the body's immune system turns against itself. This autoimmune response causes the protective myelin coating to become inflamed and eventually destroyed in places. This destructive process keeps the neurons from sending effective nerve signals. Instead, the signals are slowed, garbled, or blocked, and then symptoms of multiple sclerosis develop. Symptoms are varied and depend on the location where myelin damage or demyelination occurred. Common symptoms are loss of muscle coordination, impaired vision, numbness or tingling sensations in the arms or legs, fatigue, and incontinence. This disease can be difficult to diagnose because symptoms and their severity may come and go without any pattern. A migraine is a severe vascular headache that most often occurs over one side of the head. Blood vessels in your head work to supply the scalp and brain with blood. Migraine headaches occur when the blood vessels dilate and stretch, causing the vessels to widen or narrow rapidly. Pain fibers in the blood vessel wall become irritated, and nerves surrounding the blood vessels release chemicals, sending pain signals to the brain. The cause of migraine headache is unclear, but scientists theorize that blood flow changes and certain biochemical changes are involved. The brain is surrounded and protected by bones, cranial meninges, and cerebrospinal fluid. Meningitis is the infection of the meninges that surround the brain and the spinal cord. The warm, dark environment of the meninges is an ideal breeding ground for a number of bacteria and viruses. The bacteria that causes meningitis lives naturally in the upper respiratory tract of some people. Meningitis occurs when bacteria leaves the respiratory tract and travels through the bloodstream to the meninges. Common symptoms of bacterial meningitis include vomiting, high fever, severe headaches, and neck stiffness. It's possible for the bacteria that causes meningitis to multiply while it is in the bloodstream. The result is blood poisoning called septicemia, which appears on the body as a purple rash. Both bacterial meningitis and septicemia require immediate medical attention. Epilepsy is a condition that occurs when there is a sudden, temporary change in how the brain functions. The healthy brain is made up of millions of nerve cells, called neurons, that are arranged in a uniform, organized manner. They are constantly communicating with each other through tentacle-like connections called axons and dendrites. Neurons can generate impulses up to 80 times a second, but during an epileptic seizure, that rate can increase up to 500 times a second. As a result, a seizure may occur, causing blackouts, involuntary movement of the arms and legs, and distorted perceptions, followed by extreme fatigue. When the neurons in the brain stop sending the rapid signals, the seizure ends. The brain is composed of millions of interconnecting nerve cells called neurons. In order for your brain to function, for you to think, move, or feel, these neurons must communicate. They do so by receiving, processing, and sending chemical signals called neurotransmitters. When a neurotransmitter is released from one neuron, it binds to another at a specific site called a receptor. Much like a key fits into a lock. If the key fits, the receiving neuron will be able to process and send the signal on. A drug is any substance that once inside the body changes how it works. Drugs can be swallowed, sniffed, inhaled, or injected, absorbed through the skin, or dropped into the eye. No matter the entryway, most drugs will eventually travel through the circulatory system and reach the brain. In the brain, drugs can affect almost any step in the communication between neurons by increasing or decreasing the amount of neurotransmitter that reaches the receiving neuron, or binding directly to a receptor in its place. In the case of illicit drugs, the interference in nerve communication often causes a temporary, pleasurable sensation. In drug addiction, a person craves the pleasurable sensation produced by a drug and compulsively uses it despite its negative consequences. The use of certain kinds of drugs may also produce a physical addiction, or dependence, meaning that the drug must be present for the body to function normally. In this case, when the drug is withdrawn, the user may experience mild to severe effects ranging from nausea to death. Our bodies are made of millions of cells. Inside the nucleus of each cell is genetic information found in chromosomes, which determine all of our inherited features. Normally, each cell contains 23 chromosomes inherited from a parent, totaling 46. The cell then divides so that all cells contain identical genetic information. A person with Down syndrome has an additional chromosome 21, so that there are 3 chromosomes instead of 2. In addition to altered physical features, Down syndrome is often associated with cardiovascular problems and mental retardation. There is no known cause for Down syndrome, but research shows us that women that give birth over the age of 40 are at an increased risk of having a baby with this genetic disease. Your brain is composed of millions of interconnecting nerve cells called neurons. In order for you to think, move, or feel, these neurons must communicate with one another. They do so by sending and receiving chemical messengers called neurotransmitters. When a neurotransmitter is released from one neuron, it crosses a cleft and binds to a receptor on another neuron, and the signal is passed on. Unlike the blues, sadness, or even grief, depression is a state in which a person feels an overwhelming and debilitating unhappiness. People who are depressed may have trouble thinking clearly and may be unable to perform normal functions. They may be uninterested in eating and unable to sleep, or they may engage in these activities excessively. They may even be obsessed with thoughts of suicide. Although depression can be triggered by an emotional event in a person's life, a decrease in the level of one's neurotransmitter, serotonin, has been implicated in the biology of depression. This is why depression is often treated with medications that increase the levels of serotonin in the clefts between neurons. This leaves more of the neurotransmitter available to pass on neuronal messages. The healthy brain is made up of millions of nerve cells arranged in a uniformed, organized manner. They are constantly communicating with each other through tentacle-like connections called axons and dendrites. The brain of an Alzheimer's patient is much different. The orderly, organized arrangement of nerve cells found in a healthy brain is snarled, full of senile plaques and neurofibrillary tangles that look like an unorganized mass of nerve cells. These plaques and tangles eventually take over in the area of your brain responsible for intellectual thought. Alzheimer's affects people in different ways. Memory loss, confusion, disorientation, and poor judgment are a few of the warning signs of Alzheimer's. Your brain is composed of millions of interconnecting nerve cells called neurons. In order for you to think, move, or feel, these neurons must communicate with one another. They do so by sending and receiving chemical messages